Government Ayurveda Medical College, Mysuru recently had the honor of hosting a landmark continuing medical education program exclusively designed for the esteemed teachers of Samhita and Siddhanta. This impactful event, organized by our Department of Ayurveda Samhita and Siddhanta, was made possible through the generous sponsorship of the Ministry of Ayush, Government of India, with the support of Rashtriya Ayurveda Vidyapit, New Delhi. We are delighted to share the complete recording of this week-long academic journey. Watch now to gain valuable insights from our distinguished speakers and relive the spirit of knowledge sharing and academic excellence. Now the session is led by Dr. Vasudev Anand Rao Chate sir. He is a professor in the Department of Postgraduate Studies in Samhita and Siddhanta at Government Ayurveda Medical College, Mysuru. As distinguished academician, he holds a BMS from Karnataka University, Dharwad, and an MD in Basic Principles of Ayurveda from RJUHS, Bengaluru. He is a recognized PhD guide and a coordinator for the first year syllabus under NCISM and a member of the Blueprint Committee of RGHS. With extensive experience, Dr. Chate has guided over 30 postgraduate scholars and is an active researcher with a focus on collaborative projects and ongoing studies. He has successfully collaborated with institutions like DFRL Mysuru and Mysuru Medical College on research projects evaluating performance-enhancing activities of various Ayurvedic preparations. His ongoing research covers diverse topics including Churnabasti, insulin resistance and peripheral neuropathy, among others. Dr. Chate is also a prolific editor, having contributed to 5 ebooks on core Ayurvedic concepts such as Aturopakrama, Kala, Srotas and Gunas. He is known for his applied work on the subjects of Padartha Vijnyana and has published numerous articles in national and international journals. He has also shared his expertise with the public through a radio talk on Pakshagata aired on All India Radio, Mysuru.
Assessed that the indriyas are normal by asking the person to give some pen or pencil. So by that we come to know that the Surya is having the normal eyesight, normal hands, that motor nervous system is normal and sensory system is also normal. So today if I ask the Surya to give the pen or any pencil, that time she is unable to give. But I know that her indriyas are normal, but today she is unable to respond. So that time I come to know that this is because of the Mano-Anuvastana. That's why only they told first the Indriya assessment, after that they told Mano-Anuvastana. The sequence is because of that reason only. First you assess the Indriya, after that you go for the Manas. If Indriyas are normal, then the response is not there. That time you consider that the Manas is not here only. Okay. So this activity you can conduct in your classroom also. In the classroom also you can do that. So in the diagnosis, when you are examining the patient, if your presence of mind is not there, then there may be some mistakes you can do during the diagnosis, during the treatment, during the administration of the basti, administration of the some kshara or any other things are there. That presence of mind is very, very essential. And during your lecturer also. So when you are giving the lecture, that time also presence of mind is very, very important. So if you are thinking about your home problems or house problems or in-laws problems, mainly in-laws problems, then definitely it will obstruct the teaching. Okay, so that's why the presence of mind is very, very essential for the riding the vehicles, the conducting the class, taking the class, anything is there. So everywhere the presence of mind is essential. Yes, Vijnanam Vyavasayena. Vijnanam Vyavasayena. Here, so Vyavasaya means what the person will do. The carpenter. Carpenter will do the woodwork. The goldsmith will do the gold work. So if you give wood to the goldsmith, he is unable to do. If you give the gold to the carpenter, he is unable to do that. So by observing the work, so we can assess that the Vijnyana, Dhyana is related to Vijnyana. I can treat the patient by Ayurvedic medications. I can treat the patient by the Ayurvedic medications, but I can't construct the house because I am not having the Vijnyana of the civil science. I am not having this Vijnyana of the civil science, but the person who is expert in the civil science, that person cannot treat the. Why I am telling this one means in Google, nowadays it is the trend is started. So they will tell the symptoms. Such symptoms I am having. So what is the treatment for this one? The Google will send the treatment, but it is not a proper one. It is not a proper one. So that's why the Vijnyana is with person with the appropriate knowledge, the Vijnanam Vyavasayana. Vijnanam Vyavasayana. Vaidya with multiple qualification. That is, I am expert in the Panchakarma. I am expert in the Kshara Sutra. Then I can open the clinic with the Panchakarma and the Kshara Sutra. If I am only expert in the Panchakarma, I am not expert in the Kshara Sutra, that time I am opening the clinic with the Panchakarma. So surgeon is different, the physician is different, the pediatrician is different. Okay. So Vijnanam Vyavasayana means we are taking our children to the pediatrician. We are not taking them to the surgeon or the physician. So Vijnanam Vyavasayana is very, very important, that by observing that one, and so by seeing that one, the work and efficiency we are seeing, that we are taking the knowledge of that one. Moham Avijnanena, opposite to this one. So I know, I am expert in Panchakarma, but I don't know the Kshara Sutra. I am expert in Padartha Vijnana, but I am not that much expert in the Samhita science. Moham Avijnanena. I am not that much expert in the Samhita because I am expert in the Padartha Vijnana. I am not expert in the Shalya Tantra, I am expert in the Padartha Vijnana. So Moham Avijnana. I am not expertise in that one. Moham Avijnana means I am not a mad, but I am expert in one subject. I am not expert in the other subject. So super speciality is there, speciality is there. So Shalya Tantra specialist is there. So they will conduct the Kshara Sutra, they will conduct other things. I can conduct the Panchakarma therapies. When I will admit the patient, that time I will advise the Panchakarma treatments only. So that Moham Avijnani. Yes, on the basis of this one only, Roga Visara Vaidya is done. Roga Visara Vaidya is explained on the basis of Moham Avijnana. That is not, the person is not expert. So he will increase the Roga. He will not increase the prana, he will increase the roga. So that's why he is considered as a roga Visaravaita. Krodham. So Krodha and Abhidrohena. Here Krodha is Abhidrohena. Abhidroha means Parapidartha Pravritti. Parapidartha means so beating. Beating. So usually the mothers will beat their children, because Krodha will be there. Krodha will be there. Okay. So after some times, Krodha, so it will convert into the Priti. It will convert into the Priti. Okay. So it will convert into the Priti. So after this one, Priti is explained. So that's why only after the Krodha, the Priti is explained. Shokam, Dainyena, Rodhanadi Pravritti. Shokam Dainyena means Rodhanadi Pravritti. So crying. Rodhanadi Pravritti will be there. So that crying is there. So by crying, we can consider that the person is in the Shoka. Drought is there. Someone is expired. So losing someone. So these all factors are there that we can consider as a Shokam Dainyena. Harsham Amodena. So tomorrow the CM will finish. Will be free. So you will enjoy, you will celebrate. Okay. So when you will the result will come, no? So that time result will come, some marriage fixed, something event happened with you. So that time you will celebrate that, the one. How we will celebrate, how to assess that one means, Hetu is Amodena means Nritya Geeta Utsavakaranam. Nritya, Geeta, Utsav. When we will be very happy, that time we will start singing something. Okay, that is singing, and we will start dancing. Utsavakaranam, celebrating the occasion. Celebrating the occasion with parties. Celebrating the occasion with parties. Utsavakaranam. So Utsava Karanam is parties only. Utsava Karanam is parties only. We will celebrate. So result came. So celebrating. So my child got some seat, IIT seat, IIM seat, like that some seats he got. So then we will celebrate. We will celebrate. That celebration is considered as a Amodena. The person who got that seat, he will celebrate. The person who not got that one, he will not celebrate. There will be Rodana Adikriya. Here there will be celebration will be there. In same house. So same house. If one son got that one, another son not got. So then there will be, both the things will be there. Both the things will be there. So that you can observe. That you observe in that. Yes, Priti. Very important factor. Pritim Toshena. Toshena means? Expressing
that on face.
How you will express? That point is very, very important. Expression from both face and eye. Face and eye. Someone can smile when you come in front of them, but assess that whether that smile is just formality or because of some respect. Okay. So when during your study, so when you will visit your house, you will go back to your home that time. So when you will open the door, when your mother will open the door, that time when you see the eyes of your mother, so that will be Priti. Pritim. That's why only every film, if the love, the situation comes, that time they will tell that you see in the eye and you express that one. You see in the eye. So that is because of the each and every love scene. So you can see that there will be the dialogues will be like that only. By observing the eye, you tell it. So why by observing the eye you should tell it means there will be the luster in the eye. The luster in the eye you can observe in the some persons only. The smile may be there in the so many persons, but luster in the eye should be, it is not just expression. This is expression from the face and luster from the eye. Luster from the eye. So that 2 points are very, very important. That's why only they told that Pritim Toshena Mukha Nayana Prasadadi. That is Mukha Nayana Prasadadi. So when the patient, you treat the patient that time with satisfaction, with luster in the eye, the patient will see towards you. So that is considered as a Priti. That is considered as a Priti. Okay. Bhaya. Vishadena. Bhaya means Vishada. Something, it may happens in the future. It may cause something. So like that, some Vishada will be there. If the diabetic patient is there, if you ask them to eat this sugar, then they are having the Vishada because Bhaya will be there because that the sugar may cause some side effects. Sugar may cause some side effects. So Bhayam Vishadena, so that is fear. Dhairyam. Manaso adainyam. Dhairyam is so taking the initiation without hesitating or without fear. So that is considered as a dhairya. That is dhairya. One best example is the advertisement. That is डर के आगे जीत है. Mountain Dew. डर के आगे जीत है. That is the best example for the dhairyam. That is the best example for the dhairyam. Okay. डर के आगे जीत है. So where it is applicable means when the emergency patient will come, no, that time if you treat that emergency patient, if you come front to treat that emergency patients, then you are having the dhairya. Taking the leadership is on the basis of dhairya.
Students coming for Vivas.
Nowadays students will come with more dhairya because they know that he will not fail. But ask your student to come and give here Viva, madam. So last batch we failed five students. We failed in Viva. We failed 5 students in the Viva. So that's why we are telling you fail in the Viva. I failed students in the Bagalkot Basaveshwara College, madam. My close friend college that is. ಮಾಡಲೇಬೇಕು. ಫೇಲ್ ಮಾಡಿರಿ, ಫೇಲ್ ಮಾಡಲಿಲ್ಲ ಅಂತ ಅಲ್ಲಲ್ಲ. ನಾ ಹೇಳಿದ್ನಲ್ರಿ ಪ್ರಿನ್ಸಿಪಲ್ ಯಾಕೆ ಹೇಳಿ ಈ ಪಾಠ ಮಾಡೋತ್ತೆ ಪ್ರಿನ್ಸಿಪಲ್ ಇಂಟರ್ಫಿಯರ್ ಆಗ್ತಾರನ್ರಿ, ಫೇಲ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ಯಾಕೆ ಆಗ್ತಾರವರು? ನಾವು ಅಹಿತಾಯು ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇಲ್ಲ. ಓಕೆ, ವೀರ್ಯಂ ಉತ್ಥಾನೇನ. ಸೊ ದಟ್ ಈಸ್ coming in front, utthanena. So taking the initiation, taking the leadership, taking the initiation. So after completion of this one, when you will go back, so that time you may take the initiation that, so some CMA will be conducted in your college or some other programs will be conducted. I will become the organizing secretary. That time you may take the initiation. That initiating is there, no? So that point is very, very important. So that point is very, very important. So opening a clinic, construction of the building, house, or taking a car with loan. So these all things need dhairya only. These all things are need dhairya only. Okay.
Then what is the difference?
Huh?
Yes, difference.
ವೀರ್ಯ ಅಲ್ಲಲ್ಲ, ಧೈರ್ಯ ಇರುತ್ತೆ, ವೀರ್ಯ ಇರಲ್ಲ ಕೆಲವು ಸಲ. Some they are having the courage, but they will not come front. Okay. So initiation is also very, very important. The person is very strong. The person is very strong, but he will not take initiation to take that one. Taking the risk is very, very important. Dhairya is there, but taking risk is in the virya. Taking risk is in the virya. Okay. Coming along with wife from Dehradun is
Who are we? They are there also.
avasthanam avibhramena. Avasthanam avibhramena. Avibhramena means stable mind. Stable mind. Avastha. Here in Anumana Pramana, so many mana related things are assessed, because manas is the one which is not having the, it can be assessed with the karma only. It can't be assessed with the other things. I can be assessed with the other things. Ear can be assessed with the other things. Pratyaksha kamya bhava also. But here manas is there, no? So that can only be assessed with the Anumana gamya bhava only, because karma, it will be vyakta by the karma. That's why only they told that avasthanam. So diagnosis of the, so avibhramena means stable mind. When you are examining the patient, that time the stable mind is very, very essential to diagnose it. Otherwise, the diagnosis may be wrong. When you are giving the basti, that time stable mind is very, very essential. When you are assessing, when you are writing the prescription, that time also stable mind is very, very essential. Otherwise, when you are writing the examination, that time also stable mind is very, very essential. Shraddha. Shraddha can be assessed on the basis of bhakti. On the basis of bhakti. So here bhakti is, some may be having the habit of eating only dosa. So when you will go to the, when in team, when you will go to the hotels, no, that time they will order only dosas. Some only idlis, some only some keshari bath like that, shira like that they will order. So such sweet things some will order. So that is because of the order by the some individual person. That is because of Shraddha. Shraddha is bhakti. Shraddha is nothing but a bhakti. Okay. So selection of Anupana on the basis of Shraddha only. Maybe the patient may not take the ghee. Sir, I am having aversion towards the ghee. I am having aversion towards the milk. So many times when we are prescribing the protein powder, that time they will tell that, no sir, we are not drinking the milk. So that time we will switch on to the avalehas. Avalehas are available, that time we will switch on to the avalehas. So some will tell that, no, I am diabetic, so I will not take the madhu or this one, ghee. So like that, so this Shraddha, bhakti is there, no? So on the basis of that one, you can switch on to the other things. Other, what is, so comparatively good one. Medha. What is the meaning of here, Grantha Grahanena? Retention means what? Remembering the?
Understanding it in the right way.
Understanding?
Analyzing and understanding in the right way.
Retention So retaining and applying it also becomes the
Retention and applying. So here grantha word. What is the meaning of here grantha? How we will apply that grantha? Huh? Shastra. So only just Shastra it is? Knowledge. Whatever is read.
Learned, anything that is learned.
So can you apply it to the first year students? Recitation of sloka. Then grasping power. Next.
Result, anything you have to please.
Result is different, madam. Result. How the valuation will take place, that you also know.
anatomy and physiology, which
Subjects are very. Grantha here means subject. Grantha meaning here subjects. In the first year there are 5 subjects are there. Whether the student is well versed in all the 5 subjects, 4 subjects, 3 subjects, 2 subjects or 1 subject. So on the basis of this one only, the surnames were kept in the north side. That is Chaturvedi, Trivedi, Drivedi. So these names are on the basis of what? On the basis of they know the 4 Vedas, they know the 3 Vedas, they know the 2 Vedas. So like that only, if you know, the student know about all the subjects of first years, then he will be having the excellent medha. In the second year also, in the third year also. Okay. So the Grantha Grahana means here Grantha is subject. Here Grantha will be subject. No doubt. Other all factors are right. What you tell, the grasping power, recalling power. So everything is right. But here Grantha stands for what means? Grantha stands for, nowadays it stands for the subject of the BMS students, subjects of the PG scholars. So like that you can analyze it. So on the basis of that one only, Rajavaidya, Pranabhisaravaidya. So these are classified on the basis of that one only. Rajavaidya, so superior, because you know more than the just Vaidya. More than, that is super specialist is there. Super specialist is there, like that. Saudhya. Where you will apply this one, Saudhya? Upamana Pramana. In exam, ಎಲ್ಲಿ ಹೇಳಿ?
Remembering students' patients.
ಇಲ್ಲಿ ನಾಮಗ್ರಹಣೆನೇ ಹೇಳಿದೆ ನಾನು.
consciousness of the patient, whether you are recognizing orientation to name, place and time.
Name, place and time for students.
For patients, consciousness assessment, because he is
Good.
Conscious level for the patient, whether when we ask to give me the pain, the patient is giving you pain only. Means the particular word is fixed for the particular material. He knows the thing properly. Because in some diseases this happens.
So which patient you are applying for this one?
Parkinson's, like memory loss, any kind of
brain CNS examination we have
This is serious patient, bedridden patient. You are analyzing. When someone will come visit that patient, that time some attender will take them, the guest, near the patient, and they will ask, see who came. If they recognize the name, then the person will live for some more days. Otherwise, there will be arishta lakshanas. The person will die soon. Namagrahana. Here Namagrahana is, particularly Namagrahana is told. So analyzing the consciousness of the patient during the bedridden conditions. During the bedridden condition. That time only you analyze it. Not when the patient, the students will go for the viva or the spottings. In the spotting, it is not there. It is Jnana, Vijnyana. It is Jnana and Vijnyana. It is Namagrahana is in the emergency conditions. Okay.
So Samyava has wrote this when he tells Sanna Stapana Dravya. He tells that is Sanna, it is Jnana. He Chakramani comments.
ಅಲ್ಲಲ್ಲ ಜ್ಞಾನ ನೋಡ್ರಿ, ಈಗ ಒಂದು ಹೇಳಬೇಕು ಅಂದರೆ
ಇದು ಎರಡು ಡಿಫ್ರೆಂಟ್ ಕಾಂಟೆಕ್ಸ್ಟ್.
ಅಲ್ಲ, ನೀವು ಸಂಜ್ಞಾ ಸ್ಥಾಪನ ಬಂದಾಗ 2 ಥರ ಸಂಜ್ಞಾ ಸ್ಥಾಪನ ಬರುತ್ತೆ. ಒಂದು ಸಂಜ್ಞೆಯನ್ನು ಅಂದರೆ ಕಾನ್ಷಿಯಸ್ನೆಸ್ಸನ್ನು ತರೋದು ಒಂದು ಕಡೆ ಆದರೆ, ಇನ್ನೊಂದು ಮೇಧಾವನ್ನು ವೃದ್ಧಿ ಮಾಡೋದು ಬರುತ್ತೆ. It is having both the functions. It is having both the functions. So regaining the consciousness or the enhancing the meda. Enhancing the meda. So when you are giving for the enhancing the meda, that time it will enhance the on the basis of concept of gamitva. On the basis of concept of gamitva, if the person is suffering with the knee pain, that time you will give the Yoga Rajagogulu. If the person is having the pain on the shoulder, that time also you will give the Yoga Rajagogulu. But Yoga Rajagogulu will reduce the pain of the knee, reduce the pain of the shoulder also. So how it will reduce means on the basis of concept of gamitva, so that it will reach the target organ. So similarly, when you will give the medicines with different anupanas, that time it will reach the target organs. When you are giving with ghee, that time it will be act as a medakara. So that is, it enhances the meda. So when you are giving with other dravyas or as a the nasya or any other modes are there, that time it will brings the saudhya. It will bring back the saudhya. So these different aspects are there. So one study conducted in our hospital, our college. Oh, you are the examiner for that one. Smriti, Smarane, Ilbantu name. Smriti, Smarane. Okay. So how much you will remember? So that you are analyzing. That you are analyzing in the examinations. Out of 10 spottings, how much you know? How much you know, that you are analyzing on the basis of what? On the basis of smriti. So when the patient comes, that time you will diagnose that patient, and when you start the writing the medications, if you know, if you remember or recall all the medications, then your smriti will be good. Unable to recall, that time when you are opening the book and again you are studying and again you are writing that one, that will be, so your memory will be reduced. So these things are there. So that is smritim smaranena. Okay. So smriti vibrashta is explained in the Pradnyaparad. The Dhriti smriti vibrashta karmayat krutyashu. So this is application of, extended application of the smriti. Extended application of the smriti will be smriti vibrashta. Riyam. So Sheelam Anushīlanena, same will be there. Dvesha. So difference between Krodha and Dvesha will be, in Dvesha, the person will reject you and he will not talk with you. So in the Krodha, the person will beat. The person will beat. Here person will not talk. So Dvesha is this one. Krodha is, so that's why I told that the mother will beat the child and after 10 minutes they will do the Priti. But in the Dvesha, Priti will not come. So if the no avastika, it will be forever. It will be forever. Upadhim anubandhena. Upadhim anubandhena. Uttarakalina phala. Anubandha is uttarakalina phala. For example, if the person suffer with the paralysis attack, the person is completely unable to walk, so he will bring to the hospital. After that, some treatment will be given. So the patient may be become somewhat better, but his gait will be changed. His gait will be changed. That will be uttarakalina phala. Unable to talk properly, unable to eat food properly. So these all things are there. After complete cure, after complete treatment, some defect will be there in that. So those are considered as a uttarakalina phala. So what is the difference between upadrava and upadhi? Means in upadrava, it will come along with the disease. So here the upadrava will be coming along with the disorders, but this upadhi or udarka will come in the later. Udarka will come in the later. Okay. Dhritim, alaulyena, strong will or firmness. So if you tell, I will go for the CME programs, then I will go. Can I go there or can no go no, like that? If you are having the confusion or dual mindedness, so this is considered as a Take any one firm decision. So I will go. That much only. So I will go means I will go. So this is the firm decision. Actually, I should appreciate the madam. Sir, I booked the ticket. You select me afterwards. I booked the ticket. So this is actual Dhairya and Dhriti. Actual Dhairya and the Dhriti. Actually, I have not selected her in the initial stage, but she told that, sir, I booked the ticket. You yes, madam. Yes, that's why I took the example of Dhriti, no? That's why I took your example for the Dhriti. Vashyata Videyata. So what is explained in the Ayurveda? So that if you are following with no questioning, you are not questioning anything, so then it is considered as a Vashyata. So can you question your parents? No. Now you can question, but so Vashyata is Videyata. So that's why it is told that Videha Paramadaraha. So Ayurveda, Dharmartha Kama Mokshanam, Arogya Mulabatamam, Ayurveda Upadesheshu, Videha Paramadara. Brahmi Murta Uttishta means we should wake up in the for what? Swastha. If you want Swastha Rakshana, Swasthata, then you wake up at Brahmi Murta. Otherwise you wake up at your regular time. What is that? Regular time ಯಾವ ಸರ್ ನಿಮ್ಮದು? ಟೈಮ್ ಹೇಳ್ರಿ ಕರೆಕ್ಟಾಗಿ. 6 ಅಲ್ಲ, ಇನ್ನೊಂದು ಸ್ವಲ್ಪ ಹೆಚ್ಚಿಗೆ 7. ರೀಸನ್ ಹೇಳ್ರಿ. 7 ಇದು ಕನ್ನಡದೊಳಗೆ ಏನಂತಾರೆ 7ಗೆ? 7. So that is nothing but 7. Okay. Vaya Bhakti Satma and Roga. So here, Vaya is assessed on the basis of Kala. So that is first one is Balyavastha up to 16 years. Some told that it is up to 25 years. Okay. So why Charaka told Balyavastha up to 25 years? What is the Anumana Pramana behind this one? The firm evidences are there for that. Why he told up to 16 to 25 is considered as a Balyavastha, that definitely there will be some evidences are there, some reasoning is there, strong reasoning is there. So what is that reasoning? What firmness?
Recent neuroscience research ಪ್ರಕಾರನು up to 25 years neuro generation ಆಗ್ತಾನೆ ಇರುತ್ತೆ.
One is that. Next. How we will prove that one? With any other evidences are there? Very good. Secondary ossification period. Secondary ossification period will finish at 23 years. Age of 23. So that also mainly the pelvic ring, that pelvic bone is there, no? So that pelvic bone ossification will take up to 23 years. That's why only up to 21 years the female should not get married. Female should not get married up to 21 years. Okay, so the secondary ossification, on the basis of secondary ossification only they told that 25 years. Such a wonderful reasoning they have given that one. Bhakti. So Madhya Pradesh. Sir, why I told, so that some extension may be there, sir. So they may, what on the basis of that dissection only, dissecting the dead body, they come to know that. So it is somewhere 1 or 2 years, 3 years, there will be changes will be there. But explaining on the basis of this, reasoning on the basis of this one, dhatu pakvata, dhatu paripakvata. So asti dhatu is the hardest dhatu. So asti dhatu paripakvata will take later. So they analyzed the asti dhatu paripakvata only. So there, because remaining factors they left. Asti dhatu paripakvata they took, they assessed the secondary ossification also there. So secondary ossification will take up to 25 years. So that's why only it will be near to 25. Someone told 16, 20, 22, 25, 30. So that will be the, so paripakvata asti.
ಧರ್ಮಪಾತ ರಾಸ ಆಗುತ್ತಲ್ಲ ಸರ್, ಎಲ್ಲ ರಾಸ ಆಗ್ತಿರ್ಬೇಕಾದ್ರೆ ಇವನ್ ಆಸಿಫಿಕೇಶನ್ ಕೂಡ ಮೋಸ್ಟ್ಲಿ ನಮ್ಮ ಏಜ್ಗೆ 23 ಬಂದಿರ್ಬೋದು, ಅವಾಗ 30
ಇರ್ಬೋದು, ಹಂಗೂ ಇರ್ಬೋದು. ಫುಡ್ ದ ಅಸಿಫಿಕೇಶನ್ ಪ್ಲೇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್. ವಿತ್ ದಿ ಫುಡ್ ಇಸ್ ಪ್ಲೇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ರೋಲ್. ದ ಹೆಲ್ದಿ ಫುಡ್, ನಾವು ಜಂಕ್ ಫುಡ್. Now we are taking more junk foods. Now we are not taking some calciums. Okay, so that may be the Bhakti Madhya Desha. So usually they want Godhuba. So here Kerala, always they want the rice items. They desire for the rice items. If you go Delhi or UP, there they will take aloo. Aloo will be aloo paneer. They will take. So in Bangalore, the bath items. Variety of bath items. Okay, so if you go Uttar Karnataka, there are rotis. So like that, the bhakti will differ from person to person. So that will be very, very important. According to their bhakti only, they should consume. So I am having this disorder, take Siridhanya. So it is not common for all. Siridhanya is not Satmya for all. Okay, if you are having Satmyata, on the basis of Satmyata only, you should proceed for the diet. So your diet should be on the basis of your habit. Your diet should be on the basis of your habit. Satmya. That's why only they told next Satmya. On the basis of bhakti only Satmya told. Okay. So next will be Vyadi Samutthana. So on the basis of Vedana Visheshata. So that is Pratyatma Lakshanas are told. All 30, 60, 90 disorders what explained in the Charaka Shashruta Vagmata Samhita. So there Pratyatma Lakshanas are told. So this is the Vishama Jwara. Pratyatma Lakshana is told. Sannipata Jwara. Pratyatma Lakshana is told. Vata Jwara. Pratyatma Lakshana is told. So on the basis of that Pratyatma Lakshana only, so those are considered as the hetus. Those are considered as hetus, and the disease will be the sadhya. Gudalinga Vyadinam Upashanupshayabhyam. Gudalinga Vyadi. So if you are unable to diagnose by the symptoms, that time go with the some other procedure. So here by that you will come to here, if you are giving the Sneyana Svedana, if the symptoms aggravates, then it will be Amavata. So Hetu will be the by Sneyana Svedana, aggravation of the doshas, aggravation of the symptoms, that's why it will be Amavata. So there will be reduction of the symptoms, then it will be Sandhigatavata. So Hetu Sadhya Sambandha. Paksha will be Sharira. Paksha will be Sharira. Dosha Pramana Apachara Visheshena. What is the meaning of this one? Dosha Pramana Apachara Visheshena. Example. Vata. Then here Pramana they told. Mana. You assess the mana here. How to assess the each guna? Here it will be on the basis of Vikalpa Samprapti. It is on the basis of Vikalpa Samprapti, that is Amshamsha Kalpana. Apachara Visheshena. So for example, Sita Guna Ruddhi will be by the consuming the Sita Ahara and exposure to the Sita Vihara. So analyze that only Sita Ahara is there, or Sita Ahara with Sita Vihara is also there. Along with that, Sita Ahara Vihara, Ruksha Vihara is also there or not? Ruksha Ahara is also there or not? So that also you analyze it. Okay. So by analyzing the Nidhana, you will come to know that, so how many dosha gunas are increased there. So if the Ruksha, Lagu, Sita, 3 gunas are associated in the Nidhana, then there will be increase of the Sita, Ruksha and Lagu guna. Why this is very, very essential means in the treatment aspect, you should give only Ruksha, Sita and Lagu guna opposite properties. That much is sufficient. No need of giving the other. That's why only they told 500 Mahakashayas. It is not 50 Mahakashayas, it is 500 Mahakashayas. So choose it, take it. So select it on the basis of Amshamsha Kalpana. Amshamsha Kalpana, that is Vikalpa Samprapti, will be the analyzer on the basis of what? On the basis of Dosha Pramana Vishesha, that is Apachara Vishesha. Arishta Ayukshaya. Arishta will be Ayukshaya. So that is already discussed. No need of discussing this one. Upasthita Shreyastvam So this is very, very important. So this is analyzing your future. Upasthita Shreyastvam means analyzing your future. How systematically you are spending your day-to-day life. So that is very, very important. Your organized life will be the sign of the future life. If you are consuming excess of the junk foods, drinks, alcohol, so everything will be there, then your liver will be damaged after 10 years or 20 years. You will die in the near about 40 to 50 years. Okay. So if you are waking at Brahmi Muhurta, if you are following all Dinacharyas, if you are following all Rutucharyas, if you are following the all Sadruta and other, what sir told, all the things, if you are following those all factors, then the future will be good. The future will be good. So this is not applicable to only health aspect. This is applicable to other aspect also. If you are saving the money in the proper way, some are having habit of purchasing the gold, some are habit of purchasing the land, some are habit of doing the some FDs in this one, some are having habit of putting in the share market. So where if you are getting the benefit of that one and the amount will be gathering or it is increasing by day, then your future will be good. If you are doing the proper saving, so then your future will be good. That is Vyavasthita Shreyastvam. How you are planning your life. How you are planning your life, so that will be the future. That will be the future. Selection of the college. So selection of the college is also very, very important. So according to your, all the things, you should select the college because your husband will be there only. So your some other factors will be there only. So that's why only you selected that college. But in that college, whether you are happy or not, whether you are taking the opportunity or not, whether you are putting the effort to growth in the future or not, that you should observe. That you should observe on the basis of what? Vyavasthita Shreyastvam Kalyana Abhiniveshana. The future life will be analyzed by the observing the person in presence with FDs, with the investment, with systematic life. So all these factors will be there. Amalam, again it will be related to the Sattva only. Amalam, whether you analyze it, whether you are having the Amala or not. So whether you are having the anxious, whether you are having the depression. So these all factors are not then it will be Amala. Amalam, Sattvam Avikarena. Sattvam Avikarena. I am completely free from anxiety. I am completely free from depression. I am completely free from all other factors. Then it will be Amala. Then it will be Amala. Otherwise, what will happen? First, you will get anxiety, you will get depression. After that, your same thing will be transferred to your husband, your children, in your home. So everyone will get the same symptoms. Same. That will be same. Because of that reason only, always maintain the Amala. Amala is very, very important for the future normal life. Prashna Pariksha. So here, one more factor is told. This is very, very important. Till this, what the Charaka told, those all factors are Pratyakshagamya Bhavas. All factors are Pratyakshagamya Bhavas. Hetu always only not a Pratyakshagamya Bhava. Sometime it will be a Pratyakshagamya Bhava also. When it will be in the Apratyakshagamya Bhava, that Hetu, that time you should analyze that Hetu on the basis of Prashna Pariksha. Dhuma, we are observing there. That is Pratyakshagamya Bhava. Sveda Varoda Santapa Sarvangrana, we are observing in the patient. So that is the Pratyakshagamya Bhava. Some are there, those are Apratyakshagamya Bhavas are there. Those assessment of Apratyakshagamya Bhava is only on the basis of Prashna Pariksha. On the basis of Prashna Pariksha. So some examples are here. Grahani, Mrudu Darunatvam, on the basis of Prashna Pariksha. Grahani, Mrudu Darunatvam will be on the basis of Prashna Pariksha, whether, so how the patient will passes the stool, whether it is loose or it is constipated or it is normal, the alternative day or regularly. So like that, if you ask the question, then it will be, so assessment. Swapnam, is it possible to see the Swapna? No, not possible to see the Swapna. Only it will be assessed on the basis of Prashna Pariksha only. Prashna Pariksha only. Okay. How many types of sapnas are there? What are those? Bhavita. Name. Karpita. Yes. Among them, how many will give the proper effect? How many will be afalavan? How many are falavan and how many are afalavan? First three will be Partita, Kalpita, Bhavita. Two are giving the phala. Drishta, Shruta, Anubhuta will give the Drishta, Shruta, Anubhuta, Kalpita, Partita will not give any phala. Only two things are there, that is Bhavita and Doshaja will be giving the Bhavita means Purva Janma Kruta Karma, so that will be Bhavita. Doshaja means because of the dosha, you will get the Swapna. These two will give the phala. Why I am telling this one? Because some Jyotishis will be there, they will tell that Swapna Vikara will be treated, Swapna Vikara will be, so some Yajna Yaga will be done here, by that you will get the benefit, mainly in the Kerala. It is there, mainly in the Kerala it is there. But so Bhavita and this Doshaja is there, no? They will give the phala, but it is not having any medications or any other things. So by that you can treat that one. Okay. So Bhavita and Doshaja will definitely that will give the phala. Best example will be Karan Arjun film. Karan Arjun film. नहीं देखा है मैडम? Karan Arjun film नहीं देखा है? Yes, other applications of Nidra. Nidra is also on the basis of Prashna. So here in the Nidra, you will get both. By Prashna also you can ask, otherwise by direct Pratyaksha Gamya Bhava also. So Anning is there, the red eyes will be there. So those are factors are there, that also. Antiki, Vegiki, Maniki, Shuddhi in the Virechana. Yes, now you analyze it. Antiki, Maniki, Vegiki, Shuddhi in the Virechana. So here how many are Pratyaksha Gamya and how many are Apratyaksha Gamya Hetus. So you analyze the Hetus. Antiki is Antiki in the in Vamana it will be Pratyaksha. Pittante Vamana. Can we see Pitta there? Patient will tell there will be burning sensation. There will be burning sensation. Only Maniki is there that you can assess by the Pratyaksha Gamya Bhava. Remaining two are there, those will be assessed on the basis of Apratyaksha Gamya Bhava. Antiki, Vegiki. How many Vegas are there? Vega can also be considered on the basis of the Pratyaksha Gamya Bhava. Okay? Time is 12:15. Can I take this one afternoon? ಮಧ್ಯಾಹ್ನ ತೊಗೊಳ್ಳೋದನ್ನ can 12:15 ಆಗಿದೆ 11:30ವರೆಗೂ ಸರ್ ತೊಗೊಳ್ತಾರೆ still 1 hour needed. Okay, I will take afternoon session. Okay. Sir, assessment of quality, the assessment of hetu is very, very important. So whether this is hetu is valid or not, so that point is very, very important. By keeping this one in the mind, Acharya explained that there are 5 qualities are there. If all the 5 qualities are there, then it will be sadhetu. If any one among the 5 qualities is absent or defected, then it will be asadhetu. The sadhetu lakshanas are pakshe sattvam, sapakshe sattvam, vipakshe vyavrutatvam, asat pratipakshatvam, abhaditatvam cha. These are the 5 qualities are there. The first one is pakshe sattvam. It should be present in the paksha. When dhuma is present on the parvata, then only we can analyze that here Agni is present. When the symptoms are there in the patient, then only we can diagnose that patient. If the symptoms are absent, then there is no need of diagnosing, there is no need of giving the treatment. So first prerequisite is the paksha, in the paksha, the hetu should exist. Hetu should exist. Pakshe sattvam. Second one is the vyapti. What is vyapti is explained, no? So the where it is explained, there it should be associatedly present. It should be associatedly present. That is sapakshe sattvam. For example, Svedavarodha, Santapa, Sarvanga Grahana and Jwara are the vyapti. Hetu sadhya sambandha are there. So wherever we will get the Svedavarodha, Santapa, Sarvanga Grahana, there we will get the Jwara. Where we will get the Jwara, there we will get the Svedavarodha, Santapa and Sarvanga Grahana. These qualities are there. Okay. So it is definitely explained in the Charaka Samhita. It is explained in the Charaka Samhita. So Charaka Samhita is considered as a sapaksha. Charaka Samhita is considered as a where we are getting the pratyaksha gamya bhava and aptopadesha gamya bhava of vyapti. So where we are assessing the vyapti, where we are getting the knowledge of the vyapti with help of the pratyaksha or aptopadesha. So that place is considered as a sapaksha. So if Dhuma and Vannis are taken, then Mahanasa will become the vyapti, the sapaksha. Sapaksha, it is not limited one. So here in Mahanasa we may get that one, or in outside that also we may get the Dhuma and Vanni association. Similarly, Svedavarodha, Santapa, Sarvangrana and Jwara are the Lakshana, not only explained in the Charak Samhita, it is also explained in the Shushru Samhita, Vagbhata Samhita, Madhava Nidana. There also we can get the sapaksha will be more. The sapaksha will be more. So any one among the aptopadesha or any one among the pratyaksha we can here we can quote like that. Okay. So this is the sapaksha where the hetu sadhya sambandha definitely explained or we are getting. So that place is considered as a sapaksha. Then vipaksha vyavrutatvam means it should not present in the vipaksha. It should not present in the vipaksha. For example, Dhuma and Vannis are there. It is present in the where the pakshata is not there, no? Where pakshata, the ability is not there, there it should not present. Pakshata is not there, there it should not. Pakshata is very, very important. That's why I told the pakshata is very, very important. The ability is there. Paksha is having that ability. So the ability is not there. In that place, if hetu is present, then it is considered as a vipaksha sattvam. Vipaksha, it is present in the vipaksha. So in Jalashaya, Jalashaya is not having ability to hold the Agni. So for Agni, the Jalashaya will become the vipaksha. Svedavarodha, Santapa, Sarvanga Grahana are these Lakshana will never present in the Madhumeya. So the Madhumeya is the vipaksha for the Svedavarodha, Santapa or Jwara. Vipaksha for the Jwara. Vipaksha for the Jwara. Like that. That's why only we are taking only Pratyatma Lakshanas. Some other Lakshana may be present. Some other Lakshana may be present. Only Pratyatma Lakshanas are there, no? Those Pratyatma Lakshanas are only present in those Pakshas, but in Vipaksha those are absent. If they are present in the Vipaksha also, then there will be confusion. Then there will be confusion. So where the ability is not there, in that place the absence should be there. The absence should be there. So this is called as vipakshe vyavrutatvam. It should absent in the vipaksha. Satpratipakshatvam, there should not be any another counter hetu which will disprove this one, which will disprove the A. For example, if A sentence is there, so then if the another B sentence is there which will disprove the A sentence, then it is considered as a Satpratipakshatvam. Then it is considered as a Satpratipakshatvam. Last will be Abhaditatvam. Bhadita Hetvabhasa is it will also disprove the thing on the basis of Pramanas, on the basis of other Pramanas. So if other Pramanas are available to disprove that one, then it will be considered as a Abhaditatvam. So it should not be there. Other Pramana should not be there. Other Hetu should not be there. Other hetu should not be there, and it should be present in the paksha, it should be present in the sapaksha, and it should not be present in the vipaksha. These 5 qualities are there. If these 5 qualities are there, then it will be considered as a sadhetu lakshana. Any one among the 5 is absent, then it will be considered as a asadhetu. Then asadhetus are hetu abhas. Hetuvat abhasante. It look like a hetu. It look like a hetu, but it is not a real one because of defect in one, any one among the pakshe sattva, sapakshe sattva, vipakshe vyavrutatva, or in pakshe it may not be there, or some other bhadita may be there. So like that, one defect will be there. On the basis of that defect, so this one is considered as it look like a hetu, but it is not a real hetu. The person may look like a doctor because of the wearing the apron and putting the steth, but he is not a real doctor. He is not a real doctor. He is the Rogabhisara Vaidya. He is not a Pranabhisara Vaidya. He is a Chadmachara Vaidya. Actually, he is a Chadmachara Vaidya. By analyzing, by cross questioning, he told that you put the cross question. So you ask the question from the Grantha. If the person is able to tell, that time you consider that he is a Pranabhisara Vaidya. He is unable to give the answer. That time you consider that he is a. This is the analysis by the Anumana Pramana. This is the hetu. By ask the questions of related to that disorder, some disorders. If the person is able to give, then you consider that is Sadhetu. Okay, the person is right. So these are the hetu sadhya sambandhas are there. On the basis of that one, it look like a hetu, but it is not a real hetu. It is not a real hetu. Okay, next is a hetu hetvabhasa. So there are 5 hetvabhasas are there. Savyabichara, Viruddha, Satpratipakshatva, Asiddha and the Bhadita hetvabhasa. There are 5 hetvabhasas are there. In Savyabichara hetvabhasa, again 3 are there. Sadharana, Asadharana and the Anupasamhari Savyabichara hetvabhasa. In Asiddha hetvabhasa, Asraya Siddha, Swarupa Siddha and Vyapyatva Siddha, 3 hetvabhasas are there. So totally 5. In 2, there are 3 divisions are there. Okay, we will discuss one by one. Along with that, we will discuss these hetvabhasa by comparing with the one another. By comparing with the one another. Yes, here the first 3 are there. Prakshe Sattva, Sapakshe Sattva, Vipakshe Vyavratatva. Any defect in these 3 qualities, then it is considered as a Savyabichara Hetvabhasa. It is considered as a Savyabichara Hetvabhasa. Then in first one, Sadharana Savyabichara Hetvabhasa, what will happen? The hetu will be present in the paksha. Okay, that is fine. It is written. It is also present in the sapaksha. Yes, that is also quoted in the classical text. But it is also present in the vipaksha. So on the basis of when it is present in the vipaksha, so that is rejected. That is, it is not a cardinal symptom of that, the object what we are going to prove. So pakshe sattva, sapakshe sattva, vipakshe vyavrutatva, the defect will be there in the vipakshe vyavrutatva in the sadharana savyabichara hetvabhasa. Example quoted here is ayam go vishanitvat. Barkombidi, you write down this one. Ayam go vishanitvat. So ayam is, which is the paksha, which is the sadhya, which is hetu. Here, name the paksha, sadhya and hetu. Go is the, yes, go is the sadhya. Yes, next. Vishanitva is hetu. Ayam is, here ayam is paksha. Ayam is paksha. Then sapaksha. Sapaksha will be another cow. Another cow. Any other cow. Go gavaya. You can also take gavaya also. Okay. So another cow. Vipaksha. Animal. Any other animal. Any other animal will be vipaksha. You write down any buffalo. Any one name you write down there. So that will be vipaksha. So it is present in the vipaksha also. It is present in the vipaksha also. On the basis of that one, here the this is cow, it will be proved not with help of the horse. Some other signs and symptoms may be there or some other qualities may be there, but only by horns are present, we should not tell that this is cow. This is cow. So on the basis, so that's why only they told that it looked like a hetu. Yes, cow is having the horns, no doubt. It looked like a hetu, but it is not a proper hetu to prove that object. It is not proper hetu to prove that object. Okay. So this is jwara because of only body ache. That is wrong. That is wrong. Because in the some other diseases also we are getting the body ache. In vipaksha, body ache is present. Okay. So on the basis of that one, it is told that I am go vishanitva. So here, this is ulcerative colitis because of the pain abdomen. This is applied question. This is ulcerative colitis because of the pain abdomen. So here paksha will be this is paksha. Ulcerative colitis sadhya. Pain abdomen is hetu. So hetu is present in paksha sattvam is right. Sapaksha sattvam is also, it is told in the Davidson or any API medicine. So there also it is told. So aptopadesha is there. But in vipaksha, some simple atisara, some other disorders are there. There also we are getting the pain abdomen. By only pain abdomen, the patient cannot be diagnosed as a ulcerative colitis. Ulcerative colitis. Hatred. Doubt? Huh?
No doubt, sir. I was just thinking of other diseases also.
Other diseases are so many other. In females, so many uterine disorders are there. So many other disorders will come. Okay. So it is hetu, sadhya, paksha. Okay. One more example. Ayam pitta jwaraha ushnatva. Only by ushnatva we can't diagnose it as a pitta jwara. Because in kaphaja jwara also ushnatva is there. In vata jwara also ushnatva is there. So in vipaksha, ushnatva is present. On the basis of that one, we can't diagnose it as a asadharana savibichara hetvavasa. Asadharana savibichara hetvavasa. Okay. Here, hetu will be absent in the sapaksha. Hetu will be absent in the sapaksha. Okay. Example we will take. So by example we give. Shabda nityaha shabdatva. Shabdo nityaha shabdatvat. Shabda nityaha shabdatva. Okay. So shabda is paksha, nitya is sadhya, hetu will be shabdatva. Okay. So what is sapaksha here? Sapaksha is absent. Sapaksha will not absent. Sapaksha is present. But you identify sapaksha. Huh? Vayu. Vayu then? Sapaksha I am asking you. Huh?
Musical instrument.
Musical instrument. Musical instrument will become sapaksha? Swara? Shabdatva?
Vishaya is there.
Huh?
That is Vishaya.
Let them tell, sir. Otherwise they will sleep. If they are interacting, then it will be good. In sapaksha, we are assessing the hetu sadhya sambandha. We are assessing the hetu sadhya sambandha. Here what is sadhya? What is sadhya? Nitya is sadhya. So then sapaksha will be other nitya dravyas. Sapaksha will be other nitya dravyas, that is Khadinyatma Manakala Dishasha Dravya Sangraha. Among them, the Akasha has been taken. The remaining 8 you can take. Remaining 8 you can take. So in that, in classical text book, the Padartha Vijnyana book, Atma word is given there. Atma is Nitya. It is not having the Shabdatva property. Okay, here Atma, Sapaksha is Atma. Atma is there. But in Atma, the Shabda Guna is absent. Shabda Guna is absent. Shabda Guna is absent. So Nitya, when we are proving the Nitya, that time Sapaksha will be Nitya. There we are proving the cow, that time we have taken the Gavaya, Go Gavaya, like that we have taken. Here we are proving the Nitya Dravya, so we have taken the another Nitya Dravya. Akasha is one Nitya Dravya, remaining 8 Nitya Dravyas are there. In 8 Nitya Dravyas, the Shabda Guna is absent. So on the basis of that one, it will be disproved by the Sapaksha Sattvam. It is absent in the Sapaksha. So second Asadharana Sabhavichara will be disproved by the Sapaksha Vyavrutatvam. Sapaksha Vyavrutatvam, that is absent in the Sapaksha. Absent in the Sapaksha. Amaliki is Rasayana because of Amla Rasa. Example is Amaliki is Rasayana because of Amla Rasa. So Amaliki will be Paksha, Rasayana will be Sadhya, Amla Rasa will be Hetu. So now you take Sapaksha will be any other means Guduchi. You can take Guduchi. Guduchi will be the other Rasayana Dravya. Guduchi will be Rasayana, but it is not having the Amla Rasa. Amla Rasa. Okay. So here the Vipaksha, it is Sapaksha Vyavrutatvam. In Sapaksha it is absent. On the basis of that one, Asadharana Sarvepichara Hetuvavasas are explained.
Sir, here, what is the difference between Ahetu and Hetuvavasas?
Ahetu is told by Charaka. That much only. Prakarana Sama, Samshaya Sama are there. Varna Sama.
So, ಇದು ಪ್ರಕರಣ ಸಮಾನಗಳು
ಇಲ್ಲ ಅದು ತುಂಬಾ ಬೇರೆ ಬಂದ್ಬಿಡುತ್ತೆ, ಕನ್ಫ್ಯೂಷನ್ ಆಗುತ್ತೆ, ಬೇಡ. ನಾನು ನಿಮ್ಗೆ ಹೇಳ್ತೀನಿ ಕೇಳಿ. ಫಸ್ಟ್ ಯು ಲರ್ನ್ ದಿಸ್ ಒನ್. ಅದು ಬೇಕಂದ್ರೆ ಇಲ್ಲೇ ಇದೆ ಸ್ಲೈಡ್ಸು, ಹಾಕಿಕೊಡ್ತೀನಿ, ನಾನು ಇಲ್ಲ ಅಂತ ಹೇಳಲ್ಲ ನಾನು ನಿಮಗೆ. ಈಗ ಪ್ರಕರಣ ಸಮಕ್ಕೆ ಹೋಗಬೇಡಿ. ಫಸ್ಟ್ ಯು ಲರ್ನ್ ಹೇತುವಾಭಾಸ, ಆಫ್ಟರ್ ದಟ್ ಯು ಕಂಪೇರ್ ವಿತ್ ಚರಕ ಇಸ್ ಎಂಟೈರ್ಲಿ ಡಿಫ್ರೆಂಟ್. ದಟ್ ಡಿಫ್ರೆಂಟ್ ಎಕ್ಸ್ಪ್ಲನೇಷನ್ ಇಸ್ ದೇರ್. ಓಕೆ, ಸೊ ಈ ಜಸ್ಟ್ ಯು ಲರ್ನ್ ದಿಸ್ ಒನ್. ಇದು ತುಂಬ ಚೆನ್ನಾಗಿದೆ, ಇದು ನೋಡ್ಕೊಳ್ಳಿ ಮೊದಲು, ಆಮೇಲೆ ಬೇಕಾದ್ರೆ ಕಂಪೇರ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಓಕೆ, ಸೊ ಹಿಯರ್ ಅನುಪಸಂಹಾರಿ ಸವ್ಯಭಿಚಾರ ಹೇತ್ವಾಭಾಸ. ಅನುಪಸಂಹಾರಿ ಸವ್ಯಭಿಚಾರ ಹೇತ್ವಾಭಾಸ. ಹಿಯರ್ ಎವ್ರಿಥಿಂಗ್ ಈಸ್ ಅನಿತ್ಯ, ಸರ್ವಂ ಅನಿತ್ಯಂ ಪ್ರಮೇಯತ್ವಾತ್. ಸರ್ವಂ ಅನಿತ್ಯಂ ಪ್ರಮೇಯತ್ವಾತ್ ಹಾಕಿ ಹೇತು ಸಾಧ್ಯ. ಪುಟ್ ದಟ್ ಹೇತು ಸಾಧ್ಯ ಆ್ಯಂಡ್ ಸರ್ವಂ ಅನಿತ್ಯಂ ಪ್ರಮೇಯತ್ವಾತ್. ಸರ್ವಂ ಅನಿತ್ಯಂ ಪ್ರಮೇಯತ್ವಾತ್. ಓಕೆ, ಹಿಯರ್ what is hetu? What is hetu? Prameyatvat is the hetu. Okay, so what is sadhya? Anityata is the sadhya. Okay, then sarvam is paksha. Okay, so which is sapaksha? ಎಲ್ಲ ಕಾರ್ಯದ್ರವ್ಯ, ಕಾರ್ಯದ್ರವ್ಯಗಳು. ಹಾಂ, ತಗೊಳ್ಳಿ. ಹಾಂ, ನಥಿಂಗ್ ಈಸ್ ಹಾಂ, ದಟ್ ಪಾಯಿಂಟ್ ಈಸ್ ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಕ್ಯಾನ್ ಯು ಡಿಫ್ರೆನ್ಸಿಯೇಟ್? ಸರ್ವಮ್ ಈಸ್ ದೇರ್, ಸೊ ದೆನ್ ಹೌ ಯು ವಿಲ್ ಡಿಫ್ರೆನ್ಸಿಯೇಟ್ ದಿ ಸಪಕ್ಷ? ವೆನ್ ಪಕ್ಷ ಈಸ್ ಕಂಪ್ಲೀಟ್, ಸೊ ಹೋಲ್ ಯೂನಿವರ್ಸ್ ಈಸ್ ಪಕ್ಷ, then what you will differentiate from that universe? Okay, so sarvam is there, word sarvam is there. It is difficult to differentiate the sapaksha and the vipaksha. It is difficult to differentiate the sapaksha and the vipaksha. So here Sapaksha and Vipakshas are absent, so it is considered as a Anupasamhari Sarvebhichara Hetuvas. On the basis of that one, Anupasamhari Sarvebhichara Hetuvas. Now, the difference between Sadharana, Asadharana and Anupasamhari. Difference between the Sadharana, Asadharana, Anupasamhari. Then only it will be clear. Okay. So, in Sadharana, Hetu there in the Vipaksha. In Asadharana, Hetu is absent in the Sapaksha. In Anupasamhari, both. Yes. There is no Sapaksha and the Vipaksha. Sapaksha and Vipaksha are absent. Sapaksha and Vipakshas are absent. So, the Pakshe Sattvam, Sapakshe Sattvam, Vipaksha Vyavritatvam, in these three qualities, so there will be defect, then it will become the Sarvebhichara Hetuvas. Then it will become the Sarvebhichara Hetuvas. Okay. Viruddha Hetuvas. Viruddha Hetuvas. Okay. Ayam Ashvaha Vishanitvat. Ayam Ashvaha Vishanitvat. Put the Paksha, Sadhya and Hetu. Paksha, Sadhya and Hetu. Ayam is Paksha. Ashva is Sadhya. Vishanatvat is Hetu. Okay. So, here the Hetu itself disprove the Sadhya. Hetu itself disprove the Sadhya. Because the Hetu never exists in the Sadhya. Hetu never exists in the Sadhya. On the basis of that one, it itself disprove the Sadhya. It itself disprove the Sadhya. आप लोग एक बार आपका वायवा में बच्चे आए रहते ना, वो जो बोलते रहते ना, उसको भी कंपेयर कर सकते, वो सभी हेतुवास के ऊपर ही रहता है, जो so you can analyze that the wrong answers given by the students. Okay, so those all are on the basis of Hetuvabhasa only. On the basis of Hetuvabhasa only, because some other, the defected Hetu will be there. Defected Hetu will be there. Just you analyze it. Whether it is, usually they will tell with Viruddha Hetuvabhasa. Viruddha Hetuvabhasa will be more useful. So this is Sandhigatavata because of Atmana. Atmana never exists in the Sandhigatavata. Atmana never exists in the Sandhigatavata. Okay. Atmana never exists in the Sandhigatavata, so it is considered as a Viruddha Hetuvabhasa. Satpratipakshatvam. Satpratipakshatvam.
Sir, in the previous, can you give any other example which we can give for the first years, because they don't
for which, madam?
Sandhigatavata, Admana and all.
This one, Viruddha. So many examples are there. This is pen because it will not write. This is pen because it will not write.
But application aspect.
Application aspect also you can tell anything. This is Vata because of Snigdha Guna. This is Pitta because of Shita Guna. So whatever wrong things if you tell, that will be Viruddha Hetuvabhasa. So best example you can take for the first years. Their neat wrong question answered no. Those all are Viruddha Hetuvabhasa only. What they appeared wrongly, so because of that they are in the Ayurvedic college. That will be because of the Viruddha Hetuvabhasa only. That will be because of Viruddha Hetuvabhasa. Okay. Satpratipakshatva Hetuvabhasa. Another one more Hetu will be there. Another one more Hetu will be there. The contrary Hetu will be there, which will disprove the. But what example given is right. The example given in the A is right. But example B also present. Example B also present. So that will disprove the example A. Example B also present. That will disprove the example A. So example A is Dugdadantaha Nityaha Asti Bhagatvat. Dugdadantaha Nityaha Asti Bhagatvat. What is the derivation of Asti? Coordination between the 14 department is very, very essential. When you are teacher, that time you should go Rachana department also. Asti is derived from asati iti asti or vasati iti asti. The things remaining part, the muscles and other things will disintegrate or destroy, but only thing will remain, that is asti. That will be asti. Okay, so it will remain in the there only. That's why only in Dharmasthala they are. And one more near this Gadag, Annigere, some skeletal were extracted and they were analyzed. So such things were there. Asati iti asti or vasati iti asti. So it will not destroy or disintegrate, decay. So on the basis of that one, it is told as asati or asti. According to Charaka, Danta is considered as a asti. Danta is considered as a asti, according to Charaka. So taking this point, the Danta, the premolar teeth or the Dugdha Danta, Nitya, because of it is asti bhaga. But now can we have any Dugdha Danta? No. Patanasila. So on the basis of Patanasila, one more, another contrary hetu is there, that is Dugdha Dantaha Anityaha Patanashilatva. Patanashilatva. So on the basis of that one, contrary hetu is there. So that's why only it is considered as a. Here, the Pramana will not play any important role. So Pramana will not play important role. Just sentences are there which are nearer to that one. So on the basis of that one, this will be disproved. Okay. Asiddha hetu avasa. Asraya siddha, Swarupa siddha and Vyapyatva siddha hetu avasa. 3 asiddha hetu avasas are there. So first one is for you only. This example is for you only. For you only this is example. Really, I will tell that one.
The Paksha doesn't give Ashraya to Hetu. That is
Paksha will not give
Ashraya to Hetu.
any other. Paksha will not give Ashraya to the Hetu. Paksha only not existing there. Paksha only not existing means Paksha is there. Paksha is not there, not like that. Actually, she is right. Paksha is not having ability to give the Asraya to the Sadhya. Not having ability to give the Asraya to the Sadhya. Akasha is there. Akasha is there. But it is not having ability to give the Asraya for the Kamala. So on the basis of that one, Pakshata illa. Pakshata ability illa. Okay. So on the basis of that one, it is told. The female patient is having pain abdomen because of the So testes are not present in the female. Testes are not present in the female. On the basis of, she has not given any Asraya for that one. She is not an Asraya for the testis. On the basis of that one, so this example can be given. Okay. So one Hindi song is there. फूलों का चेहरा तेरा, कलियों का मुस्कान है. बोलते रहते हो ना तुम? हाँ? किसी किसी को तो बोलते रहते हो ना, इसलिए बोल रहा हूँ. ಏನು ಮಾಡ್ತಾನೆ ಇದನ್ನು ಕಂಪೇರ್ ಮಾಡ್ತಾ ಇದ್ದಾನೆ ಆ ಥರ ಹಂಗೆ ಅವನು ಆ ಥರ ಮಾಡಿ ಅದು ನಿಮಗೂ ಗೊತ್ತು ಯಾರ್ಯಾರಿಗೆ ಹೇಳಿರ್ತೀರಾ ಅಂತ ತಿಳ್ಕೊಂಡೇಳಿ ಆ ಥರ. ಸ್ವರೂಪ ಸಿದ್ಧ. Swarupa Siddha here, Swarupa is absent. Swarupa is absent. Yesterday only we discussed that one. What is the difference between the Asraya and Swarupa is? Asraya is absent here. Here Swarupa is absent. Swarupa is absent. Okay. So, Shabda Gunanityaha Chakshushatvat. Shabda Gunanityaha Chakshushatvat. Actually this is told by Charaka only. Charaka told that Shabda is Drishtartha. Shabda is Drishtartha. There are 4 types of Shabdas are there, no? Drishtartha, Adrishtartha, Satya and Anruta. So it is contrary statement to the Charaka only. It is told by Charaka only. So Drishtartha Shabda, how you are telling that it is Drishtartha Shabda? Charaka told that we are observing the signs and symptoms by giving that medicine in the patient, so it is considered as a Drishtartha. So why there are four? Drishtartha, Adrishtartha, Satya and Anrita. Shabda is Aptopadesha, Shabda is Pramana according to Charaka or not? Shabda is Pramana according to Charaka. Aptopadesha is Pramana. Shabda is not Pramana. Why Shabda is not Pramana? Shabda is Aptopadesha only. Yes, their Anrita classification is there. On the basis of that one, it is not counted under the Pramana. Aptopadesha is counted under the Pramana. So here, Drishtartha, Adrishtartha, Satya Anrita are told. Why Satya Anrita are told? Huh? You have to differentiate. How we will differentiate? How we will differentiate? Yavadu? Asatya bantala. It is on the basis of Karakana Siddhanta, whatever explained in the Charaka Samhita, that you can observe in the patient. Okay. Sometimes, maybe because of the wrong diagnosis of the doctor, or that is completely wrong. Because by the Kshanabhangaravada, whatever utpatti of the vitiated dhatu utpatti will take place, that will be destroyed. But it is not like that. By Svabhava Paramavada, it is not like that. It will destroy. But utpatti will be same. Utpatti will be same. By destruction, that's why only Agnivesh asked that 4 questions. What is the Chikitsa? What is the role of Vaidya? What is the meaning of that one? And the effect, the end part of that Svabhava Paramavada is very, very important, that why you should treat that patient. Because, why you should treat the patient? After all explanations, what is the role of Chikitsa is, by Chikitsa, you are bringing normalcy in the patient. When the patient will become normal, that time they will perform the Dharma Karya. That Dharma Karya is very, very important. By Dharma Karya, he will achieve the moksha. Indirectly, you are the Nimitta Karana for the moksha of that patient. So that is there in the end part of this, that Chikitsa Pravruti Adhyaya. So that is the main ambition of Chikitsa. That is the main ambition of Chikitsa. Okay. So that's why it is true. Okay. So entirely the Ayurveda is independent darshana. It is not at all dependent on the darshana shastra. Okay. That is written in the class. This one syllabus, like that only we are going. But actual part is, so it is completely independent darshana. Okay. So by this I conclude my session. Thank you so much. Thank you for patient hearing.